Welcome to the Let's Keep It Light podcast, and thanks for listening. In this episode, Ginger and Marcie will discuss addressing neuropathy with light therapy.
Okay, well, today's topic is neuropathy. And I actually was very surprised to find out some years ago that millions and millions and millions of people suffer from neuropathy. So, Marcie Denton, what is neuropathy?
Well, besides it being a real pain for people, it is a issue that develops over time. It is related to the circulatory system, believe it or not, and it's related to tissues that don't get fed. And the tissues can be, generally, it's in the feet, but it can be the hands, it can be the arms, it can be other locations. But it all comes from the nervous system, and that's why it's called neuropathy. It comes from dealing with nerves that are not fed effectively. Well, how do nerves get fed? Nerves get fed with oxygen. And where do you get the oxygen? You get the oxygen from blood. So the whole role of the circulatory system is to bring oxygen to tissues who use it to burn up food, to give it energy, to make tissue to actually function and do its job. Well, what goes on? Why is it that it stops? What's going on with this whole, my feet are numb. I can't walk well. I can't hold a screwdriver anymore. All of the complaints that we hear about neuropathy are very, very serious. In fact, neuropathy of the feet causing imbalance is one of the top causes of falls, which is the top cause of decline and death in elders. So we're not talking about a minor issue. We're not talking about an inconvenience. We're talking about a major health issue. And how can we deal with it with light? So let's talk about the circulatory system.
And the help that is available from photobiomodulation or light therapy.
Absolutely. One of the prime benefits of applying light is the increased circulation. In fact, that's at the top of all the list, is what does light therapy do? What is photobiomodulation good for? Increased circulation. And why is that good? Because it carries oxygen to tissues that need it to function. So here we are. We've got a situation where someone's feet are numb or their hands are numb. It didn't just happen overnight. There are tissues circulatory tissues, we have arteries and we have veins, but we also have very small vessels. And it's the microcirculation that is affected. It's the first to go. It's the first to just quit working. It's the first to deteriorate. And why does that circulatory vessel deteriorate? Because there's a blockage and the oxygen doesn't get to that tissue. And what is surrounding that tissue are nerves. So we talk about neuropathy being a issue of having tissue that is numb. And that's the truth. But it all starts because there is a lack of food, oxygen, and nutrition going to tissues that need it to function within the system of our body, which is nerves tell the tissues what's happening on the exterior of the foot, for example. The shoe is rubbing. well, if the nerves aren't working, you don't know, and you get a blister, and the blister becomes an ulcer, and the ulcer becomes infected, and then you end up losing your foot. That's the consequence of neuropathy that people don't talk about much. So when we emphasize that light therapy, photobiomodulation, is a preventative and an interventive, so we can intervene in the process of disease in such a way that people don't lose their limbs, that they don't fall, that they are capable of function. And it has to do with increasing the nutrition to the nerves.
So is that why, for example, with diabetic peripheral neuropathy, one of the biggest issues is that the person with that is developing those leg ulcers or foot ulcers, wounds and things that just won't clear up?
You've hit the nail on the head, basically. So if you don't have diabetes, there's a system of repair that seems to be much more robust than the system for repair that diabetics have, because of the debilitating effect of diabetes on tissue repair. Any injury to tissue is a risk. It has the potential of just going from bad to worse. And that's where we see the impact. How do you take care of an ulcer in a situation of, say, neuropathy? It's aggressive, and you have to work outside the world of light therapy. You have to work within the medical community because of the seriousness of it. Light therapy is much more effective as a preventative than as a repair mechanism once a person has gotten to that state of damage. It doesn't mean that it can't increase the repair efficiency of what's happening to that tissue that's happened. They're putting it on, however they treat wounds for diabetics. Light therapy is essential to making it happen efficiently, but that's another level of issue that you can prevent if you're using light therapy on a regular basis.
I hear what you're saying as far as we really want to prevent it before it ever becomes the issue that there is a wound on the feet, or the ankles, or the legs, or whatever that won't heal because of the lack of circulation when we're dealing with diabetic neuropathy. But one of the things that I just want to also just interject at this point is that, yes, that's true, but also that photobiomodulation or light therapy is notoriously good for wound healing. So we want to make sure, I just want to make sure to interject that for right now, but also clarify a little bit more on that.
Obviously, it is essential for wound healing. It's almost like, how can you expect the wounds to actually heal without it? Almost. That's how we feel. That's what we've seen. I had the opportunity to work in the UK for 6 weeks. I took a program for implementing light therapy for neuropathy in Cardiff, Wales. And what was amazing was the fact that they have an exquisitely fast response to anyone who has diabetes, who has a bruise or a minor injury. They're on it. They send nurses daily to that person. It is just, eyes open up, but they didn't have at the time light therapy. So we were negotiating how to implement this one intervention that would make such a huge difference. I was so pleased to be able to be part of that conversation. And it's now effective. They now are using it in conjunction with their aggressive approach to the issue of bruising and damage to tissue not for diabetics.
And again, the they that you're speaking about is
the health system that was in place in Cardiff, Wales.
And you went to the United Kingdom for
implementing a neuropathy program within the podiatry world.
Okay.
Yes.
Great. And so is this a good time to distinguish between the diabetic peripheral neuropathy and chemo-induced neuropathy, or is that a conversation for...
No, that's perfect. Anything that damages the circulatory system can cause neuropathy. And it is very important to understand, if you are a cancer patient and you're receiving chemo and you're beginning to experience some numbness, we need to get light on you right away. It should be a common understanding, but we're still working at implementing light therapy within all areas of the medical world. Knowledge is power. So if we know of people who are receiving chemo and they want to do alternative approaches, we should be able to share with them the benefits. And it's being well received now as opposed to 10 years ago when it was still so new. It was being looked at with, caution. Today, it's welcomed. And that's what's fun about talking about it today with you, is that we know that tomorrow we will understand even more. And we will see the benefits multiplying. I'm excited that we're able to visit about this now, and that we'll have to come back and do more specific when we get more specific questions.
So many years ago, when I first started using the pad-based system, which was my first exposure to light therapy, was a pad-based system, and this is probably, I can't remember, I say different, 15 years ago or something like that. And so whenever I get really excited about something, I have to tell my family first, so told all my siblings and then my friends and then my colleagues. And we always try everything out on our family first. So I want to be able to know it works before I share it. And so I had shared it with one of my family members, and her husband had type 2 diabetes, and he had neuropathy in his feet. And his ankles were very, very swollen. It didn't look like he had ankles. As a matter of fact, it just, his leg just went into his foot. And so I think it was 2 or 3 days into his using light therapy. I don't even think he used it on his feet. We were at that time, just putting the light therapy over, like on the back. We were putting it on the belly and putting it on the face. I don't believe that he used it on his feet. He might have. But 2 or 3 days into him using it, he was standing at his garden outside, and he looked down and he said to my sister, "I have ankles." He hadn't seen his ankles in years because now the swelling was reduced. He could then feel his feet, and it started just within a couple of days of helping his neuropathy. And that was from type 2 diabetes.
Wow. Well, I do want to make a comment on what to do with the light if you do have neuropathy. And I have a couple of different people who have shared with me how valuable this little bit of I guess it's called a hack now. It's a trick. The way that we talked about it earlier was that it was a microcirculation issue, and the nerves need the oxygen or they die and they become numb. Well, how do they grow back into function? Well, you have to think about trees. Trees grow from the tip. They don't grow from the middle of the branch. So how does a nerve grow? A nerve grows the myelin sheath that allows it to function from the tip. Well, if it's not alive, if it's damaged, you're not going to get anything going there. So where would you need to put more oxygen, more blood flow, more nutrition on a nerve to encourage it to grow? It's on the place that is not numb. So you take a pencil and you go up your leg or your arm and you find out where it's not numb and where it is numb, and we call that the transition. If you don't put light on the transition, you may not get new tissue that can then resolve the numbness.
That is fascinating. So say it one more time.
So in order to repair, you have to provide nutrients to living tissue. And if it's numb, we're well aware that that nerve is not doing its job. And we don't know why. We have a theory, etc. But what you want to do is feed the tissue that is alive, the cell, the nerve that is functional. It will make new tissue because it's alive and it's functioning. So you find out, you take a pencil, you go up your numb area until you get to where you can feel it, and that's where you apply light. And as that tissue grows, the transition moves. You've got to figure that one out.
And so you're saying that feeding the tissue is we're feeding it with light because every living organism needs light to function properly.
It increases circulation. It reduces the inflammation. And it is an essential nutrient for developing new tissue.
So folks, this is something that you can do yourself. You can figure this out for yourself, exactly like Marcie just said that. You can find out where that, of course, we're going to put the pad or the torch or whatever you're using, light therapy device. We're going to put it where the numbness is, but we're also going to put it at that transition point, Marcie.
Yeah, well, I didn't really emphasize the fact that you've got to put it on the numb feet. You've got to put it where it's numb because the tissue needs that oxygen. The tissue that isn't being fed with information of a nerve still needs to heal. So you do have to put it on where it's numb. But if you're trying to improve the function of the tissue, you'll need to help the nerves, which is at the transition.
Excellent.
Marcie Denton and Dr. Ginger Bowler are certified light therapy instructors and co-founders of the Light and Energy Training Seminars certification program. You can send us an email with your questions and comments to podcast@letskeepitlight.com, and be sure to visit us on Facebook and Instagram. This episode was engineered and mixed by Dr. Decibel Productions. I'm Sarah Weston. Thanks for listening, and until next time, let's keep it light.